Okay, let's go ahead and get started here. Just a few housekeeping rules in case you haven't memorized these already. First, silence your phones, please. Photography is permitted, subject to speakers' request not to capture pre-publication information. Recordings will be available after the meeting on the website. Our social media policy says everything can be shared. If the speaker asks that it not be shared, please respect that. Remember, the hashtag for the event is ABRF 2026. We're going to ask that you hold questions to the end, but we're hoping to have a great discussion with that, and you will also be receiving a survey at the end. So with that, I want to introduce my good friend and colleague, Dr. Savannah Sims. So Dr. Sims is the Director for Global Health R&D Advocacy at Research America, a national nonprofit medical and health research advocacy alliance. That's a lot of A's in there, yeah. In this role, Dr. Sims works to advance policies and funding to support medical and public health progress. She engages directly with congressional offices and other key stakeholders to advocate for robust, sustained investment in research. She also tracks science and global health policy developments, convenes cross-sector partners, and develops accessible, evidence-based resources, including briefings, reports, and advocacy materials to inform and mobilize support for research. Before joining Research America as the Dr. Leroy Hood Science Policy Fellow, Dr. Sims was a postdoc at St. Louis, where she studied immune responses in pediatric brain tumors. She is a scientist among us. She earned both her undergraduate degree in immunology and medical microbiology, as well as her PhD in immunology and microbial pathogenesis from West Virginia University. Quick test. Let's go.
Mountaineer.
Woo! All right, she still got it. All right. So Dr. Sims is a strong advocate for STEM education and public engagement. She believes that empowering the research community, that is us, to communicate effectively with decision makers and the public is essential for advancing science and addressing real-world challenges. So please join me in welcoming Dr. Savannah Sims.
Thank you so much. And as was alluded to, I did test this beforehand, and I guess I got a little excited over the Let's Go Mountaineers chant. But yeah, I know Dr. Martin from graduate school, so she was probably like, oh my gosh, I have to listen to Savannah talk again, because she actually ran our seminar, our internal graduate school seminar program, so she has had to listen to me talk a lot. But first of all, I just want to start by saying, thank you so much for inviting me here today. And, I think that this is a really important moment to be thinking about policy and thinking about advocacy. And so one of my favorite parts of my job is getting to come to rooms like this and learn from you. And so, I have this presentation prepared. However, I really want us to I want to leave time for discussion. So think about your questions. If there's really something burning, you can feel free to interrupt me. I'm happy to, I'm not a very strict personality, so, feel free. But and I'm also, I'll have my contact information and be available afterwards, because, part of what I do, which I'll explain, is learn from you all, so that when I am talking to, people in the administration, at the federal agencies, members of Congress, I want to be able to elevate those stories. And so I really appreciate you all extending me the opportunity to learn from you today as well. And so I think with that, I think we're close. Oh, yep, here we go. Sorry, I have to lean kind of far over to make sure that they were there. So this is me. Thanks again for having me today. And so what I first want to do is take a moment to introduce Research America, the organization that I'm here representing. And so we are a national, nonprofit, nonpartisan advocacy alliance. And so what that means is my company and I represent over 300 members across the research and development ecosystem. So when I say the research and development ecosystem, we represent patient groups, and this can be, part of our membership are things like the American Cancer Society, the Alzheimer's Association, so those kind of household names that you've heard of when we think about patient groups. But we also represent some really small patient organizations that, for example, are a group of parents who represent their child's rare disease and they don't have a government relations shop of their own. We also represent, members like you in this room, so professional societies. a large breadth of our membership is universities and academic health centers, research institutes. We represent scientific societies, other nonprofits and philanthropies, as well as some members of the biopharmaceutical and medical technologies industry. And so this, I think, is what makes us a little unique as an advocacy alliance, because we represent really from start to finish. So conceptualizing and asking that question, hey, what is that problem in research? And why aren't we asking these research questions to actually getting those interventions and those drugs into the hands of patients? So anyone who's involved in research is what we represent. And so at the end of the day, what we want is to ensure that that is a seamless process, that process is well funded, and that we assure that research is invested in so that it makes it to the hands of people at the end of the day. And just as a little bit of a personal introduction, I've alluded to the fact that I am what some people in DC like to call a recovering academic. So, I'm a scientist by training myself, and I got into science policy and advocacy because, I had these questions about, okay, I work with a lot of incredible scientists, so what are the holdups of actually getting that incredible research into the hands of people that need it the most? And so those types of questions, and as was alluded to, I went to WVU for graduate school, but I'm also from West Virginia, and like many other communities, West Virginia is kind of a place where people don't think that science or politics or healthcare work for them, because frankly it doesn't, right? And it wasn't designed that way. And so that's a little bit about how I got into this, and why I really think that empowering everyone in our communities and our research community is really important right now, to make sure that advocacy is done, and that advocacy is heard by the people that need to hear it the most. Because, and frankly, there are a lot of issues right now, and there are a lot of competing interests. And so when I think about how do I make research sound like the most important thing in the world right now, that's hard, right? But this is an area where we can still contribute, and frankly is one of those areas that has led to our success as a country, and our livelihoods, and is at the end of the day bringing about things that end up allowing us and our loved ones to live healthier and longer lives. So what are we going through today is sort of a little bit of a policy background, which I know sounds a little boring, but I think it's important, because when we listen to the news and we hear calls to action, what do those words actually mean is something important to level set. And that's why I want to go through it. And then I'll be talking about the current federal landscape. So what is actually going on in DC, what happened in the last budget round, what's happening in the next one, and what you can do about it. The next, I'm going to walk through a little bit of some kind of interesting findings from some recent messaging and public opinion surveys that we have done. That's another thing that Research America does in addition to our direct advocacy. And when I say direct advocacy, I mean going to Capitol Hill, talking to members of Congress and their staff, and also liaising with federal agencies and the administration. That's what I consider direct advocacy. Some other things we do is we do yearly, sometimes more than that, public opinion surveys, right, to see what is the public thinking about science, about research, about healthcare. And so I'll go through a little bit about that. And then the most important thing, I think, is how can you advocate? And I think a lot of this is maybe intuitive, but I hope to walk it through in a way that makes it remove some of those barriers. And so to get started, I'm going to talk about the policy background. There was art there, but it's okay. We had a couple little slide issues, so we're just going to go with it. But it had, imagine there was a cartoon figure of a scientist and some buildings that look like they could be in DC on either side of the arrow. So why does policy matter? And I want to once again level set by saying, I think I don't have to do a lot of convincing to the people in this room that policy does matter. And I know that after, in the last year, particularly maybe the last 5 years, 10 years, we have all seen that policy does impact us and impacts our day-to-day life as researchers. And so, instead of saying policy matters, I think by even choosing to attend this session, you all are my people, right? I don't need to do a lot of convincing. But what I'm hoping to do is give you these tools as a background to say, okay, how do we connect what I do to what's going on in Washington, D.C. and in reverse? And so, I think that I also want to acknowledge that this group, I think, is really unique because things like core facilities that you all work at, I think, are really uniquely positioned to feel those changes that happen in Washington, D.C. first, right? Because many of you are working as primary grantees, you're writing grants, you're trying to figure out what these changes mean for your own grants, but also, you may have seen changes in your user base, seen some of these policies impact your ability to make large purchases, your hiring, who's staffing, who's coming to you, and, all of your grantees' grants, or all of your users' grants, matter to you as well. So, I think that this is a group that really is uniquely positioned to both feel those changes and need to learn about, how to interpret them. And so I'm going to start by talking about the federal budget process. And remember, I'm a scientist by training, right? So this stuff is admittedly not my favorite subject. I think it's a little, don't tell anyone at my work that I said this, it's kind of boring. And so I am going to try and describe it as a pie, because one thing I don't find boring is dessert. And, I promise this will be, okay, I don't promise. This might be the worst analogy I make today, but don't hold me to it. So we're going to try, so that's why the pie is there. We're going to try and work through this as a pie. So these are words that I know that you all have heard, but I want to kind of break it down because frankly, when I started working in policy full time, I thought I knew what appropriations was, and I didn't really know. And I'm still learning. I text, most of my coworkers are not scientists by training, and so there are many times that I'm still like, hey, what does that mean exactly? How many votes does that mean? What is this? And so that's what I'm hoping to break down so that you and your advocacy will be able to contextualize this and see what it means. And it's also, I've been trying to think about things like in a scale of, okay, I hear this. Is it like, put it on the back burner to panic about later? Do I panic about it like next week? Or do I panic about it right now? And so level setting is what I'm hoping to do here. And so the first step of the federal budget process is the budget resolution. And this is not a law, it's something where Congress gets together and they decide the plan. And so to tie in my pie analogy, this is every year to kick off the budget process, they decide how big the pie is going to be. So how much money is there to spend? That is not somewhere that, that's like I said, it's not law, so it's not something that is typically something that we advocate around. That's a kind of Congress decision as far as research advocates. Other people I'm sure do, but that is deciding, okay, what kind of pie are we baking and how big is it? The next thing, and this is where we'll spend a lot of time talking about, is the appropriations process. The appropriations process is slicing that pie, right? So seeing who gets what slice of pie and how big. So of course, and I'll use the National Institutes of Health as my test, the agency that I will be talking about the most. But I want to say that, off the bat, that's not the only agency I know that you all care about, but I'm going to, just for simplicity, I don't think I can talk about every federal research agency, so I'm just going to use NIH. So appropriations, a lot of my job is trying to get NIH to have the biggest slice of pie possible. And that is really where a lot of advocacy can come in, is around that appropriation for NIH. And even though this is an appropriations bill, which means money, which is of course the most important thing, this is also where we'll talk about some policies that kind of slide into the appropriations bill. And if you've been watching the news, you probably know that we don't pass a lot of bills in our Congress in general. So appropriations is sort of that one thing that has to pass every year. So if you want something, getting it into that appropriations bill is a great idea, even though we didn't pass it and shut the government down for like 52 days last fall. So when I say have to pass, there's a little asterisk there. The next thing that you'll hear a lot about is reconciliation. You'll be hearing about that more in the next week or so. But reconciliation is when you realize, oh my God, I do not have enough pie, right? Like you need to quickly change the size of that pie. And so this is a reconciliation bill, changes the size of the pie. And they do this by, it's changes in tax code, things like that. Mandatory spending. So this is where you are changing the size of the pie. That's reconciliation. If you would like an example, so the One Big Beautiful Bill Act that passed, I believe, last year that we heard a lot about, that was a reconciliation bill. So that was something that, was outside of the usual appropriations process. And so therefore, NIH is not funded in those types of bills, but that's changing the size of the pie so that hopefully we can then still have a good slice for NIH and our other federal research agencies. The other two terms that I don't like to talk about but have been floating around, and so I think it's good to define, are rescissions and impoundment. And so rescissions are when Congress slices the pie and starts to serve it, and then they say, oh no, we actually need to take that slice of pie back. We don't want that. And that's where some concerns came in. I know everyone has been concerned about, for example, the NIH not spending all of its appropriated budget. That is like prime for Congress to have a rescissions, right? Because, hey, they might say, hey, okay, NIH, you obviously didn't need that much pie. So we're going to take some back because we've got plenty of things to spend money on. Impoundment is another thing that I would like to talk about, but this is kind of dubious legally. This is where Congress slices and serves the pie, and the president swoops in and decides to take your pie off the table and hide it. So that is something that we, of course, should not happen, and we don't want to happen. We don't want rescissions to happen either, which is why we need, people like you all to be talking about the incredible work that you do with your slice of pie, right? Because it's hard to justify needing a larger slice of pie if everything's cool. If you're content with the slice of pie you got, you're not going to bake another one, then you're not going to get a bigger slice next time. So this is where appropriations comes in. And so I'll talk through the process, but one thing I really want to point out first, and I have lost a couple of my clip arts, but that's okay. We're gonna go. But just trust me that my slides could be a little cuter. So the power of the purse is Congress's power. That is the most important power that the Constitution gives Congress. This is another point of leverage, in my opinion, for advocacy, because we do not, and Congress does not want to give up that power, right? So they want to be the ones deciding. So no matter what anyone else says, Congress has the power of the purse. This is given to them by the Constitution, and so they don't want to give up that power, and we should encourage them to not give up that power. And so this is how the appropriations process goes. And this is happening right now. It is appropriation season for everyone in advocacy, so I have been very busy the last couple months. And so we'll explain kind of what appropriation season means. So typically, the appropriation season gets kicked off every year in the beginning of February because the president submits his or her president's budget request. And so the president's budget request is a request. I want to underscore that. It is a request. And remember, Congress has the congressional authority of the power of the purse. They don't want to give that up. So no matter who is president, the president's budget request is a request. It is a signal of what their priorities are to their party, but it's a request. And Congress does not like to give the power of the purse up. And so that's really important to know. And I'll note this in another slide. I've got it graphically, but this is where we heard last year. President Trump threatens to cut National Institutes of Health by almost 40%. That was a president's budget request. That is not reality. And that's really important. And that's a signal for advocacy. And when I say the beginning of February, I would like to note we have not seen a president's budget request. The rumor is it's going to come out this Friday, holiday weekend, nothing like a little 4 p.m. holiday on a Friday budget drop to ruin my life. I'm out of office, so it's going to drop with or without me. But we have not seen the budget yet. I will tell you that we are expecting to see a 20% cut in NIH in the president's budget this year. Expected, that's a rumor. I don't have it on paper, but that's what we're expecting to see, which is, of course, unacceptable. There's no reason that, in my opinion, anyone could fathom having a world where NIH should be cut 20%, but that's what I couldn't fathom 40% last year. So I don't know, maybe we should take this as a win that we half improved, and next year it'll be flat funding, but we'll see. So the president puts out his priorities, right? The next thing is Congress sets the budget and the limit. So they will essentially get together, and in the appropriations committees, the House and the Senate will each set their own spending priorities. And so say the House wants to give NIH $50 billion and the Senate wants to give NIH $52 billion, and multiply that by every other federal agency. So, they set all of those spending limits, and then they have to get together and reconcile those differences, and then they come out with a final appropriations bill that then goes to the president's desk for signature. If you do not pass a budget by September 30th at midnight, you have to pass a continuing resolution, which that means flat funding. So, continuing resolution essentially says continue funding as usual, or if you cannot even agree to that, you shut the government down, which is what we've seen. And I would like to note that even though we are almost done with fiscal year 26 appropriations, the Department of Homeland Security has not been funded yet. And so we are like 93% there. And remember, this ended September 30th, right? It's March 30th. So yeah, it's been a while. And, this is why I'm sure many of you had some travel delays getting here. And just another thing to break down the appropriations process is that when we say appropriations, what we actually mean is 12 distinct bills have to pass. And so this is something that I didn't know. And so when you hear something like an omnibus package, that means that Congress has voted on all 12 appropriations bills together. And when you hear a minibus, that is when you have, say, 3 out of the 12, 6 out of the 12, something like that. And so what I spend most of my time talking about is the Labor, Health, and Human Services and Related Agencies bills. So that is one of the 12 appropriations bills that funds the National Institutes of Health, Centers for Disease Control and Prevention, ARPA-H, ARC, most of the health research agencies. And so this is where relationships with Congress people that are specifically on this committee are really important. And so this is why, you might hear about advocates talking about a Labor H bill or something like that. And so this is where I spend like 90% of my time. However, I just want to say it's also important to note that it's not just Labor H. We care about all sorts of other research agencies. Like, for example, the Commerce Justice Science Bill funds the National Science Foundation. Energy and Water funds all of the Department of Energy science. Agriculture, FDA, and related agencies, as the name suggests, funds FDA, which of course we care about a lot if we actually want to move that research into people's hands. So, there's advocacy, a lot of advocacy to go around. But another thing I just wanted to talk about is, we hear a lot about, okay, call your congressperson. Like, what are you asking them to do, right? So, and as an advocate who does this every day, what am I asking these members of Congress to do? And these are some things that I would not have originally thought about, right? So sometimes I will ask members of Congress to formally submit, they have a process for this. They will ask a member of the Appropriations Committee to say, hey, I would like NIH to be funded at $53 billion. And so then that's a formal request that the Appropriations Committee member has to either reject or adopt, right? So you're kind of putting member pressure on them. Another thing you can do is report language. So a report is something that comes out with every appropriations bill, and this is telling them how to spend the money. It is not legally binding. It's typically listened to, although that is, we'll see how that goes in the next year or two. But so, for example, this is where we will talk about language for indirect costs. That a lot of that has happened in report language, although we're hoping to get it in bill language. Another thing that we ask members of Congress to do is sign on to Dear Colleague letters. And so Dear Colleague letters are what they sound like. Essentially, a member will lead what's called a Dear Colleague letter and say, hey, colleague, member of Congress, I think the NIH should have $51.3 billion this year. If you think so too, sign on to this letter, and we're sending it to the people in charge and telling them that this is a signal. So it's a really nice show of power, essentially, right? That, I mean, the NIH, your colleague letter in the House was circulated last week, and I haven't seen the final numbers this morning, but, you know, I mean, there were something like 80, 100 members of Congress that signed on, right? So saying that, you know, hey, a lot of this delegation representing, you know, a lot of the country wants to see NIH go higher. And then, of course, we ask them to engage with people that work on the committee. So these are the members of Congress that are directly engaging. So I encourage you, if you have a member of Congress, look up what committees they're on. And if they are on the Appropriations Committee of either the House or the Senate, particularly if they're on, if you care about NIH, if they're on the Labor H Committee, subcommittee, that's a really, really valuable thing, and to reach out to them. You know, they have the power because they're actually negotiating. It's their staff that are writing the bills physically. So the next thing I'm going to do is talk about, okay, so what we've kind of set the stage. What is actually going on now? And I just want to paint a picture for you, because I think that everybody might be feeling similar to me, but like, I wake up in the morning, usually late, and then I realize, like, oh crap, I need to get my toddler up, and I, you know, make a frozen waffle and wrestle pants on him, wrestle him into the car seat, you know, get him off to school, and then I come back to my desk, I finally get my cup of coffee, and I'm like, okay, what in the world happened today or last night? Like, what on earth has happened? And I finally am like, every time I ask Alexa to like tell me the news, you know, usually I'm like, hey, play up first from NPR, right? I need to see what happened overnight. Instead of saying, Alexa, play the news, I feel like I'm saying, like, Alexa, damage report. Like this is what I feel like every morning when I ask for the news. And I feel like everybody kind of gets that and feels the same. And so, you know, I want to break a little bit down. And so, you know, I know you all know all of this. Sorry, my slides got a little like crunched, but yeah. So what does this mean for you? This is not news, but federal funding leads to grants. And without grants either to you directly or to the users of your facilities, you know, that is disrupting research, and research cannot happen. And with this uncertainty, you know, these are the impacts, right? And so this damage report that we're getting every day of where, you know, Congress isn't passing funding, there's a shutdown, there's whatever, you know, this funding instability does lead, frankly, to fewer projects, reduced demand, revenue instability, which can lead to hiring freezes. You know, who wants to stay in science when it's constrained like this? And what we're seeing is a loss of expertise and, of course, operational challenges, which you all, I'm sure, know about more than I do. But, you know, can you actually place an order for that really big microscope or that new flow cytometer, right? You know, these are having that demand. This is all related. And so what's going on in Washington, D.C., these are the impacts to you all. And I'm sure there's more, and so feel free to talk to me about them later, and I'd love to get your stories. But what I want to say is that what is going on right now, I don't ever mean to, like, I don't want to diminish the feelings of instability or fear or the really bad things that are happening in the world. But I want to take just a second to be hopeful, right? I mean, I think we all could use just a little bit of hope, right? And so I think the thing that really gives me some hope is that Congress rejected those funding cuts to the National Institutes of Health and every other federal research agency. We still got some cuts. NSF got a cut. CDC got a cut. I don't like to see cuts, but we were going from draconian cuts of 20 to 50+% to those research agencies to NIH getting an increase. And, you know, I think that is really exciting. And that's something that shows that advocacy does work, and the good work that you all do, not just advocacy, but the work that you do every single day is important enough, and that people in the community see it, and that members of Congress see it, and they say, okay, that 40% cut to NIH is an unacceptable cut, and I will use my power in Congress to go out on a limb and say, that's where I won't cut. So, we will take a win where we can take it. I wanted to see more of an increase, but, we'll take what we can get. Another important thing is that in the last fiscal year 26 appropriations bill, there were proposals in the last few years, even before this current Trump administration, to reorganize the National Institutes of Health. So I know that was a concern to many people here. There's been multiple proposals, so it's hard to keep them all straight. But one of them, for example, was smushing the 27 institutes and centers into 8. There were all sorts of other types of proposals, and so everyone's like, hey, what does that mean for me? Good news is that has kind of lost steam. We have heard we will see the elimination of a couple small centers in the president's budget, but like I said, that's a rumor, so I don't want to go spreading that. But essentially, there were 4 that were slated to be eliminated last year, and they were not eliminated. So good news, and we can hope for the same thing. And we've also heard from Dr. Bhattacharya directly, the director of NIH, that this is not a priority for him. So, if you're worried about institute and center reorganization, that's something that I put on like my 3 tiers of worry. A worry about later. Like, I don't need to worry about it now. I don't need to worry about it next week. I'm thinking about it. It's in my head, but it's not something I'm panicking about. Another really exciting thing that we saw in the bill last year, well, it shouldn't really be exciting because it shouldn't, in my opinion, been a thing, but Congress heard us when we said that terminating grants at the NIH is not something that can happen. And so, we do know that we saw grants being terminated by the administration, by the NIH itself. And, these were largely targeted, largely due to, DEI terms that were involved in those grants, or I guess I should say grants that did not align with administrative priorities. So now Congress said, okay, we do not like that, and they require NIH to notify Congress before terminating grants. So that's putting a check on the administration to say that this is not acceptable. And so I think that's good. Another thing is that in the not so hopeful category, I should have maybe done like a hopeful slide and then an unhopeful slide, but we'll see. We can only get a little hope. Of course, the leadership vacancies and staffing shortages are very significant at NIH and across our federal government largely. So that is something that we are hearing more so than any political influence, but what we are hearing from NIH is that the slow rolling of grants and, NOFOs not being put out is largely due to just staffing shortages. And frankly, the government was shut down for so long last year that they're behind, which is not acceptable. And I don't mean to give them a pass on that, because we shouldn't have those types. We should be fully staffed. However, maybe that's a little bit better than nefarious political influence, right? If people have those worries. So, but this is something that we're absolutely watching. And I just wanted to show this graph a little bit closer up. I know you can't directly see it, but this is last year. So you see that big dip, that dip from 46.8 billion to 28 billion. That's what the president proposed last year. And Congress said no, right? So we ended up with both the House bill. So remember, the House and the Senate each put out a bill. The House put out a bill that would increase NIH by about 100 million. The Senate put one out that would increase NIH by 400 million. And when they got together and talked about what their priorities were, we actually ended up with a slightly higher increase. We got a $415 million increase to NIH. And so this is what gives me hope, right? This is what shows that advocacy works, because, the president signaled that the priority for NIH was a 40% cut, and we got a 0.9% increase. Now, I know that 0.9% is not enough, right? 415 million is not enough. That's not what I asked for, but no one called me. But the fact that we went from a 40% cut to a little bit of an increase means that we have momentum, right? And that did send a signal, because if what the rumors are saying are true and we see a 20% cut, we're moving in the right direction. And so the other things I wanted to just quickly chat about are facilities and administration costs. So another big win, so these are indirect costs. A big win that we have so far, and the work is not done, is that the FY26 appropriations bill says that the administration cannot put a cap. So we all remember when there was the potential 15% cap on F&A costs. The administration cannot do that on its own because of this bill and because of what advocates did. We said that that could not be done. The appropriations committees in the bill text did acknowledge that there is reform needed, and they acknowledged directly that there's a JAG group that is working together to put forward a new proposal for indirect costs. I'm not directly affiliated with that group, but I know a lot of people that are, and so I just want to acknowledge that we may see changes happening, but that Congress has signaled due to advocacy that they understand that it should be a thoughtful and deliberate process moving forward, and that stakeholders and the people, like the experts in this room, should be involved in those conversations, and that it is not something that should be done by the administration. So we'll put that in that hope category. Other thing that's a little bit trickier is the multi-year or forward funding proposal. So many of you know that as of last July 1, the administration said that 50% of NIH grants should be what's called forward funded or multi-year funded, so all the funding up front. So I know that this group doesn't need me probably to explain this, but so if just for easy numbers, right, it's early-ish, if you were going to have a $500,000 grant doled out over 5 years, and you would typically be getting $100,000 each year, now you're getting that $500 up front. That's done at other federal agencies. It's not in my opinion, not the worst policy proposal. The idea that they stated was to give researchers and universities more flexibility. However, what happens if you start forward funding all of those grants and you don't increase the budget, right? The math just doesn't math. You're going to now be, and we saw that. We've seen from we've seen the reports that R01s were significantly, the number of R01s that went out the door between July and the end of the fiscal year, September 30th last year, was greatly reduced. And so this is something that we thought was going to have a little bit more protective language until the final hour of the negotiation bill. Like literally, I was, we thought it was in, we thought it was protected, and then at I don't know, I think this bill came out on a Sunday night, Thursday night at 8 p.m. we get an email and they're negotiating forward funding again, and we were like, no, we thought it was in. But so essentially, and this is still a little iffy, they cannot forward fund or multi-year fund at a higher level than what was done in FY25. So that's not the perfect solution, but it's not going to get dramatically worse. And we're hoping, because it was only really a 3 or 4 month time span, and I've heard a couple, I don't even want to say, I've heard rumors about what that number or percentage is, but frankly, they're rumors at this point, and so we don't know, and we're trying to get transparency from both NIH and from Congress about what that actually means, so that we can start kind of doing a little back of the envelope math to continue the advocacy on this. So we will see. This is a work in progress, but at least we consider this a win, because what we had expected to see, or what some parties wanted, is 100% for multi-year funding, which, once again, I don't want to disparage that as a policy proposal, but doing that drastically with no, kind of lean-in time, transition time, and without considerably increasing the NIH budget, we would see some significant issues there. So, we consider this as a kind of win. And then I already mentioned that Congress must notify, or NIH must notify Congress before terminating grants. So that's something, I'm going to skip over the next slide, but essentially one thing that we have seen is that there has been a significant slowdown in the termination of grants. So at some point it peaked to 1,800. Now we've leveled off at about 800. So over half of those were reinstated. So the top line is terminated, the bottom line is reinstated. And this is, I really meant to update this graph. This is updated as of the last fiscal year, because we started to get some lagging data when the government shut down. Moral of the story, it looks almost the same, give or take 5 grants. So I didn't re-update this slide, but we have seen this as a slowdown. So this gives some hope that that is last year's problem and will not be continuing, especially since they now have to notify Congress. And what we spent a lot of time doing last year is we collated lists of every grant that was terminated, and every time I went into a member of Congress's office, they said, "Oh, did you know that in your district there were 5 grants terminated by the NIH because they didn't align with administration priorities, and that totals up to $50 million that is no longer going to your district." And that got people's attention. So, it's all all the numbers. So to summarize this part, I'm going to start moving a little bit quicker, but we ended up with an increase. After being proposed with a 40% decrease, that's significant, and that shows that advocacy works, and that shows that people trust the research community and the work that you all are doing every day and know how important it is, both for this country, for our innovation, for our economic security, but also its ability to actually change people's lives, right? And that is important. We did get provisions on indirect costs. That's a pause for the moment. We'll see what comes out of it. Multi-year funding, didn't do as well as we had hoped, but somewhere in the middle, we'll say, we landed. At least there are some protections there. And the grant termination language, I think, is really promising, and that we have seen a stagnation of grants being terminated at NIH. So FY27 is happening right now. You can tell when I made these slides, I said late March. It's March 30th, and I haven't seen the president's budget, but we're hoping a Good Friday president's budget. So right now, what I'm doing, what my staff are doing, is we're on the Hill almost every day. We are submitting to portals. So every member of Congress has a portal where you say what you want. You can all do it. If you need help, I'll help you with that later, where you can formally submit what you want to see in the next appropriations bill. So we are in those portals all day long, asking for more funding, but also some policy provisions. Once again, can elaborate on that more. We're on the Hill every day saying this is what we want. And the really important thing, and sort of the elephant in the room, is we need to ensure that those grant dollars are being spent, right? They need to get out the door. And I wish I had more clarity. I'm with you. I'm in it. I'm trying to get this clarity. I'm asking members of Congress for this clarity. Well, I'm asking them to make the NIH give them clarity so that I will eventually learn. We need to get those dollars spent. We need more grants going out the door. I will say Dr. Bhattacharya, the NIH director, and once again, I'm talking about NIH, but this is relevant across the board, is committed to spending all of those dollars and speeding up those processes. They said that in front of Congress, so that's a public statement. So hopefully that holds. So the next thing I want to start to talk about, and like I said, I'm going to try and speed up a little bit, but messaging and public opinion. And so, how do we actually talk about this moving forward? And so, as I mentioned, I'm a recovering academic, scientist by training, whatever you want to call it. And so what kind of moved me into this field is that I was surrounded by all these incredible, amazing scientists with amazing ideas. But, frankly, my loved ones, your all's loved ones, are still suffering from disease, right? We still have people dying. There are many people that, interventions don't get into the hands of. And so my personal thought is that with good policy and clear, transparent communication between policymakers, the public, healthcare providers, researchers, people within institutions, internal advocacy, good communication there, that we can actually start to bridge that gap. And so this is what, I'm interested in doing. I'm going to go a little bit faster. Yeah, I don't know what happened here, but advocacy does matter. And I know it can sometimes feel like it doesn't, right? Because as I mentioned up top, how do you even choose what to advocate about, right? And how do you go tell a member of Congress, hey, research funding is the most important thing right now? That's a tough thing to do. And so one thing I want to remind you is that you are your best advocate. For example, most members of Congress are not researchers. They have never worked in a university setting. They might, it's hard to say, no, I don't care about curing cancer, but how do you actually get more into the weeds than that, right? So if you're not doing it, literally who else is going to do it? There are people like me, who do that But we need help, right? And I have to learn from you all. And so, this is something where you are your best advocate. I mean, I recently was getting a talk at like one of the dentists, one of our members who is a dental organization. And I was like, look, it's just the same way that when I go into the dentist's office, if my personal member of Congress showed up to do my filling instead of my dentist, like, I would not be happy about it. I want my dentist filling my cavities, not a member of Congress, right? It's the same thing about research advocacy. I don't want them to fill in the narrative for us. We have the narrative, right? We are the experts. And another thing is that even as someone who does advocacy every day, I don't like calling my member of Congress. Like when, people post on social media like, okay, call your member of Congress right now. Like I hate doing that. Like that feels a little like, oh, why should I be calling my member of Congress? And then my mental trick to get over that is to remind myself, they literally work for me, right? Like that is literally their job. We kind of forget that, and it doesn't feel like that, rightfully so often, but our members of Congress are elected to represent us, and our taxpayer dollars fund them to represent us. So why not give them a call, right? I mean, get your money's worth. I try and do that. The other thing is champion building, and this is another term that I didn't really get, is that advocacy is not just calling the office, and it's actually building a relationship. And so when I think about, advocacy, I often try and approach this as relationship building for the long term. So I often don't go in with an ask at first, right? It's a lot of getting to know a staffer in an office. It's building that trust as a human being. And we'll talk a little bit more about this later, but advocacy is not a one-time activity, and it's not even just when I'm saying advocacy as a building trust with, a member of Congress, because I recognize that not everybody's going to go to DC and, meet their member of Congress. However, I do encourage you, everyone has a district office, and so invite them to your university, go talk to them. Like, they're more bored than the people in DC, so they might come, and they still work for you, right? And so building that relationship, because you want to be a trusted resource. If they have a question, and members of Congress do this, they might say, okay, there's this policy proposal, but I don't know what to do about it. I mean, I had a member of Congress's staff reach out to me last week and say, hey, I got a request in for something in the next appropriations bill about proteomics. What is that? That's an opportunity, right? That is an opportunity for me, because they know me and they trust me as a human being, and they know I like science, right? That I can now have a conversation. And you can have those relationships with someone in your district office, but more importantly, you can also have those relationships with everybody in your community, right? Knowing that you are a trusted individual helps stand for science as a whole. And I'll be really quick, but a recent initiative we did that involves some message testing to see what types of messages worked. And I will say that this was restricted to 4 states, so it was geographically restricted. And we also focused on moms and seniors in 4 states. And these were all moms and seniors who self-identify as being Republican or independent. But so we focused on those individuals, and then we also focused on Republican and independent staffers to see, and this was, because most of these proposals to cut medical research have been coming from that angle politically, that's why we wanted to see what types of message testing worked. And what was really interesting to me is that how we saw that people in DC think and that people in these other states think were very different. And so I'll go through this quickly, but when I say beltway messaging, I just mean in the DC area. Things that worked really well are keeping America's position as a world leader. That is not something that moms and seniors in our in the real world care about, but that's something that people in DC really care about. Another thing that really helps, and this was a little bit more across the board, but talking about specific diseases and description of how research works is really important. And I think that's where people in this audience can fill in some of those gaps, right? How does research actually work? How does an idea actually make it into people's hands? How does that fuel a clinical trial? What is a clinical trial, right? Those are the types of questions that eventually, understanding the process of research as a whole is really important. And this slide's gonna look, yeah, it's all smushed. So sorry, this is a lot, but these are results of outside of DC. So these are what the moms and the seniors in out in the country, right? This is what they liked. So talking about diseases specifically still rang true. Focusing on treatments, improved quality of life, talking about hospitals and research institutions in their state was really important, right? So people were often, and I listened in on some of these focus groups, were disenfranchised by like the concept of, the federal government, the medical system, rightfully so, right? But when you said, this clinical trial happening at the University of Kansas, right, that is where people started to resonate. And talking about making it local was really important. Things that they did not want to talk about, which I found interesting, talking about cuts does not work because people want cuts. They want to reduce government spending. So saying, hey, cutting research is bad. That's not winning. That's not winning. Making it too like sci-fi-y, like, which I know is hard. I mean, I like sci-fi. I had a Star Trek whole slide. That didn't resonate. Of course, divisive topics like COVID-19 origins, vaccines, if we can steer it away from that, although I love talking about vaccines, so we can talk about that in another talk. Really, they also really didn't like anything that sounded draconian, right? They were like, we don't believe you, right? If we say that, oh, if you cut NIH, more people will die from cancer. They were like, like we will call you out on that BS. Frankly, right? I mean, they don't want to be lied to. They want it straight. And I think that's important to know. It's like we have to be realistic, but I think we can also balance that with the fact that research is what gives us hope for the future, right? And so I think you can start to balance that by making it local and by making it specific and making it, about families. And this is something I stole from our CEO, Mary Woolley. She loves this Abraham Lincoln quote, and I think it is really important, right? And this goes to the point of being an advocate wherever you are, not just in DC, but public sentiment is everything. Without public sentiment, nothing can fail. Without it, nothing can succeed, right? So if we don't stand up for research in our communities, no one else is going to, right? And so another thing that is hopefully I'm trying to bring it back to the hope part, is that most people, this is one of our public opinion surveys, believe that it is part of scientists' job to communicate their research to the public. I think that is a really important mandate, right? Most of us are taxpayer-funded, federally funded research scientists. And the fact that most of the public thinks that it is part of scientists' job to speak to speak about science to the public, to speak about it to their members of Congress, I think that's a huge responsibility and something that we should take into account. And so this is another thing that I like to point out. Sorry, the red is really aggressive up here. But people are rightfully confused about science. And that's something that, I joked all the time, and people would joke like, oh my gosh, I'm a scientist and like my grandma never knows what I do for a living. Like I think your grandma should know. Like, I think you should be able to explain what you do for a living to grandma. Like, I've spent some time with my grandma and she gets it. She has a brain. She doesn't want to be told that she can't understand science. She does. I actually, this is not a joke. I literally, at my grandma's kitchen table last week, decided to show her how to extract DNA from a strawberry last week. And we had a ball. She loved it. I used like 5 strawberries and we got so much DNA and it was so much fun. I was doing a public outreach thing at a local elementary school, and so I had all the stuff in my bag. And I was like, hey, Nanny, do you want to see DNA? Right? And, this is a woman who lives in a town of 156 people in West Virginia, right? If she can get it, anyone can get it. And she wants to get it, right? So when people express that they are skeptical about scientists, I encourage you not to see that as an attack, something to get defensive of. I encourage you to think of them as thinking like a scientist, right? Because isn't that what science is? We're skeptical about the universe and we're skeptical about what's going on around us, right? So if someone is skeptical about science, don't push them out, bring them in, right? That's what being a scientist is about, And I think that that's something that we sometimes lose as scientists. I have a couple more slides, but I'm really going to, it's just like one that I want to hit because I want to open this up to questions. And I know, like I'm not Taylor Swift. No one wants to listen to someone talk for like 70 minutes. So I'm going to skip here. How do you advocate to your lawmakers? Most of you probably know this, but I just want to remind you. Voting is the primary language of democracy. So if you are able to vote, vote for people who care about science, right? And encourage others to do the same. I am not, I'm not an activist. I can't encourage anyone how to vote, but the act of voting is so important and is our primary language of democracy. The next thing you can do is you can write letters. I mean, okay, I don't think anyone writes physical letters anymore. I mean, you're welcome to. I haven't done that, but email, action alerts. This is another thing I want to say. An action alert is something that advocacy groups do. You should all sign up for Research America's like weekly letter and our email alerts, which I'll have a QR code for at the end. But so something I do as a professional advocate is I write you emails. So I will like write an email that says, hey, fund NIH, or hey, whatever the other issue is. And then all you do is you type in your name and your zip code and you hit send and it goes to your member of Congress, right? Like it is 60 seconds or less, something like very easy. What I want to express is that there is a threshold for everyone here. You can do it as much time or as little time as you want. And, also advocacy in ways like public advocacy, writing a op-ed in your local newspaper. Members of Congress still read those, right? Because they need your votes. And those are things that you can do. And you also don't have to talk about what you do for a living. And I'll talk about the story that I tell in a little bit that has nothing to do with my research, but the story that resonates most. And you can call, you can meet, and remember, you can meet in their district offices. If you ever need help finding who you should talk to, like, reach out to me. This is what I do. But, okay, this is one of the last slides I want to get to. When we are talking to researchers and how we are trained to talk as scientists, that is completely upside down of what we should be talking to how we should be talking to members of Congress, right? So when we talk to, we know how to write papers, we know how to write grants. We talk about the background, then we put in the supporting details, and we spend a lot of time at the end talking about our results and what they mean. When you talk to a member of Congress, or frankly your neighbor at the pool party, or the other parent at the PTA meeting, or at a basketball game, you start with the bottom line, right? What does this mean, and what was the result, right? You start with that up front. Then you can get into a little bit of the so what gap of knowledge did this fill, but you really want to spend the bulk of your time talking about the results and what they mean and what they can do next. And then frankly, the supporting details are at the end, very little, and usually only if someone asks. And when I say, when I go to meetings on Capitol Hill, a good long meeting is 25 minutes. That's a good long meeting. And you're lucky if you get in a room. Sometimes we're in the hallway. I don't even get a seat, right? So we're not spending a lot of time saying, okay, the research question was, right? You gotta get to it. These are helpful tips, and I think, I'll make these available. But what I want to talk about, and this is, I think, the last slide, that I'm going to go over anyway, is that really what advocacy is about two things. I like to view it as education, and I think that's a little bit safer for people like us who are scientists and like science, right? Because advocacy, asking people to change their mind, feels daunting to me. But education is something that I love, right? Telling people how to, what they should know about, connecting the dots between what do we care about and what does it do for your community? That education is what advocacy is. And so one of the ways to do that is to tell a story, right? And so this is kind of how I view a congressional meeting going is, of course, you want to introduce yourself, where you're from, and if you have some basic, what I do, I tell them, hey, do you know this many dollars and this many people in your district are funded because of NIH, or if the meeting is about, a different agency, NSF, I do that too. Remember, a good meeting is 25 minutes. And I'm talking about this from a member of Congress, but I also want to highlight that when you're doing advocacy, you're not just doing congressional advocacy, you're being a person in the community. You're doing micro advocacy, right? You're doing that at the soccer field. You're doing that, when you're at the Thanksgiving table. No one wants to hear about your dissertation, right? Nobody wants that. So keeping it brief is really important. Customizing your story. So if you know that the person you're talking to has a personal connection to a certain disease, or if they really care about economic competitiveness, or, those are the things that you tie into your story. And it's okay to evoke emotion. And, you can tie, the best thing is when you can tie your story to the ask. And so, I think as was mentioned, my background is in immunology. I studied neuroimmunology for most of my scientific career. And that's not something I ever talk about when I'm in a congressional office, right? I mean, I tried, at first, and when I was doing advocacy in grad school, right, I thought it was really, really cool that I was studying this protein called JAK1 and that it usually interacted with this other protein, but I think it actually is interacting with activating transcription factor 4 when there's unfolded protein response going on. Like, no one cares, right? Nobody cares. What I do tell them is that the National Institutes of Health in the early 1980s funded a very basic research study, and they were studying how two bacteria, when they interacted, what happened to their electrical fields. And to do that, they were using platinum to understand the electrical fields of bacteria and how they communicated. I don't really understand what that study was. I don't know how they wrote their grant application to get it funded. I don't know a lot about that study. But I do know that that is about as basic of a basic science research grant that you can get, right? Science for the sake of science, which I love. I love science for the sake of science. But what I do know about that study is that that study led to the development of the chemotherapeutic agent cisplatin. And when my boyfriend was 27 years old, cisplatin saved his life. He had a very aggressive form of cancer. This was my first year of my PhD. He was my boyfriend at the time, and this was a disease that prior to that study had a 5-year survival rate of less than 8%. Because of cisplatin, my now husband is alive. He has very little side effects from experiencing cancer when he was 27 years old. And he's the father to my beautiful 3.5-year-old son. And because of that investment in research, because of the investment in a question, my full life exists. And it's not just me that has this story. It's every single person in the room has that story, right? And so without that type of basic investment in research, we truly don't have hope. And so making those connections and telling those types of stories to members of Congress and people in our community is what makes it real to them. And so that's where I will leave this. I said that, but I lied, right? Subscribe to our weekly letter, right? So you all are members of Research America. We do a weekly letter. We have other email blasts too that you're welcome to sign up. We do weekly-ish webinars about what's going on in Washington, D.C. and what that means for researchers. You can hear about them in the weekly letter. Follow us on, like LinkedIn, it's 2026. You can find us on the internet. Also, this slide did not work at all. But come up if you want my card. Happy to answer any questions. I think that QR code works. That just takes you to Research America's page. My name is Savannah Sims. You can find me in the staff list. My email is public, which is maybe questionable on our employer website. But, also it's 2026, right? You can find me on the internet. So please let me know if you have any questions. I'd be happy to take them. And thank you for being such a great audience for so long.
Everyone, let's please come to a microphone if we got questions or would like to share something that Savannah needs to know. Stories to take back.
Hi, so thank you for that. It was very informative. One of the things I think we need to differentiate between is advocating as me as a human and advocating as me as a representative of an institution. And in that role, we have been told to butt out that there is advocacy going quietly and we should not interfere with that. So what's your...
Yes, that is a huge problem, in my opinion, and there was one I expected to get. I do think what is important is to remember that you can always advocate as an individual, right? And my best tips for doing that are, and this is something that I cannot tell you exactly what to do because I am not your institution's government affairs office. But I encourage you to use your voice as an individual as much as you can. Your institution cannot tell you not to do that, right? You can advocate, and you don't have to even, you can say I'm a scientist. You can say I represent researchers. You can say I work in a facility at a local university. You don't have to tell them, my name is Savannah Sims and I'm an assistant professor at West Virginia University in the microbiology department. What we tell people and what has worked for many people in our community is that as long as you are not misrepresenting your university, that you are safe, right? You're not saying I am speaking on behalf of my university. You are speaking on behalf of you as an individual. And I think that is something that is so important, but that's a great question. And also another thing is just advocacy and lobbying are different. Lobbying is a type of advocacy, and one good way to kind of just stay away from lobbying, in my opinion, is not asking them to, especially if you're trying to avoid the institutional representation, don't tell them how to vote on a bill. You can say this bill would impact your community, my community in this way. That's education. You're not telling them how to vote. That's a good distinction. Also, I like to be careful, and I'm in a nonprofit, so I have very strict lobbying restrictions myself. I talk a lot about supporting a certain number for the National Institutes of Health, but I do that sparingly in congressional offices. I say I want a robust increase, not necessarily $51.3 billion. Things like that. There are ways, but I think that's an important distinction, and I understand that it is a really tough time to be working at universities, and they have their own things going on. I run into that too, representing universities, so I understand. It's tough.
Thank you so much. I know the research community is particularly affected by immigration policy, and I wanted to ask if there was some overlap between the types of advocacy that you do and that sort of advocacy.
Yeah. So the question, in case you didn't hear, was that there is a ton of overlap between immigration policy and the changes going on and the institutional advocacy, and what I'm doing and what the advocacy community is. I will say that I acknowledge that the immigration policy is massively impacting research. That's not a lane that Research America particularly gets into because there are so many other incredible immigration advocates out there. And so, frankly, we can't advocate for everything. It's something that we stay informed of. It's something that we offer technical support to, other organizations in our membership on. But it is something that, we're kind of behind the scenes supporting. It's not something that we're able, just frankly, due to bandwidth issues and our own staff expertise, that we don't feel like we are the right voice. Because that's another thing with advocacy is, even though it's something we support, we're not always the right person in the room to be speaking on it just because of our own level of expertise. And so, it's something that we're following closely and that, we do believe is massively impacting science and something that, we support all those other advocates in doing. So thank you.
Thank you so much. It was very insightful, and that I really like your this is story. But of course, the human story is very moving.
Right.
And when I called the Congress, the phone calls when they reduced the fund, I did exactly the opposite. I said, okay, increase the fund for the education programs because we were lobbying on that.
Right.
So, and in terms of advocacy, Is that more effective if we request a meeting or we just do all the emails? Actually, when last year I called
Yeah.
the first day, 5 offices, 2,
Good.
I had live people answering my phone calls.
Yes. Well, so thank you for calling and thank you for advocating, first of all. And I think that calling and emailing is good. It is definitely good. And just for the record, some people ask me, is calling or emailing better? What typically happens in congressional offices, I can't speak for all 535 of them, but they're sort of tallied. Emails and calls are sort of in the same bucket of, okay, these staff have to report to their boss, the congressperson. Okay, we had 12 people calling about NIH. We had 15 people calling about immigration. It's sort of so it is putting, it's putting that on the radar. In-person meetings or even virtual meetings are so important, and I would say more important, because it goes back to the champion building and the relationship building and being that person that having that bi-directional relationship of being someone that they can trust. So if you can get a meeting, I definitely encourage you to do it, but do it all.
Should we have more people calling for meetings separately or have a group meeting together?
I think you can do it either way. Groups are always good, and I will say that there's opportunities, like some people, I've participated a few years, there's something called the Rally for Medical Research. We don't organize it, one of our members does, but it's for biomedical researchers, particularly NIH focused. It's an awesome event in DC. I think it's September 17th this year, where you can go to DC as part of a group, and they kind of do all the hard work for you, like scheduling the meetings and making the leave behinds you hand out. It's an awesome event. So, and there are more events than that, right? Especially if you care about a certain disease or something like that.
I will be there March 17th next year.
Yay! Yes, it
I want
is.
to march for science the first year.
Oh, yes, that's great. And yeah, thank you for doing that. And I had another point. What was my point? Yes, so I was going to say, look out for like Rally for Medical Research is a really good one. Getting in, like on our weekly letter list, like we share a lot of those types of opportunities. But I do want to just reiterate that all advocacy is good advocacy. So, there are lower barriers of entry and higher barriers of entry. And I understand that not everyone's going to get to Washington, D.C. So do whatever you can in a way that makes you comfortable and also is in a way that is safe for you and the situation that you and your loved ones are in these times. So.
Thank you so much. It's a really good presentation, and I appreciate the passion behind the work you do.
Thank you.
I have a couple of questions. One is, does your advocacy group advocate for STEM scientists to become public servants to run for Congress? We need more of that, for sure.
Absolutely. It's not something that we do directly, I will say, but we actually have civic engagement is a huge part of that I didn't get a chance to talk about today. But I will just say I work in advocacy. I'm not a member of Congress or running for office, but I got to my organization because of an endowed fellowship that encourages, it is specifically for biomedical researchers to test out advocacy and see if they like it, and they haven't gotten rid of me yet. So, that's one example. We do internships, fellowships. We also have something called a microgrant program where, once again, not directly what you're talking about, encouraging people to, run for office, which I am all in support of, but we provide very small grants to typically grad student orgs, postdoc orgs, but very open-ended, to pursue policy or science communication initiatives in their communities, because really we know that the people in the communities know what they need. And with this program has been going on for a while, and they're often $3,000 to $4,000 grants. They are micro grants, right? We've had some incredible micro grantees. Some of them have set up neuroscience learning curriculums in juvenile incarceration facilities, right? Incredible stuff. They also do science fairs and hill visits and sort of the canonical advocacy, if you will. And we've had former micro grantees go on to, I don't know if you all are familiar with the McClintock Initiative, but this is a group of young scientists who have been helping and encouraging people, scientists in their communities, to write op-eds in their local papers and helping them with tools to do that. And so that was one of our former micrograntees that we're very proud of for like spearheading that initiative. So it's, once again, it's not something that we want them to do that. You know, we don't necessarily like fund campaign, right? You know, we don't do any of that work, but we really prioritize civic engagement and trying to get scientists, particularly young scientists, involved in the world of advocacy and politics in whatever way that fits.
Thank you. This next one is a bit of a Pandora's box, I'm sure. Some of the headwinds that we're facing is misinformation towards science, especially when it comes from Secretary of Health and Human Services, et cetera. Do you have some kind of an elevator speech that you can share of how to address the situation when you're coming against those headwinds of misinformation?
That is such an important question, just making sure everyone heard it. It's, you know, what is kind of the elevator pitch to address misinformation? And I want to point out also disinformation, which is intentional misinformation. And, you know, when the people who are sharing such mis and disinformation are very prominent political figures. And I'm not sure if I have an exact elevator pitch per se. And this goes back to my general advocacy tips of always having a personalized response. But as an example, something that, you know, I've been combating in my personal life, right? I mentioned I'm a mom of a young kid. Is, you know, a lot of my peers in my community have been telling me, well, with everything new that has come out about vaccines, I am now concerned. And I guess my elevator pitch is, well, I actually, you know, studied immunology. I've worked in vaccine labs. I've done that for 10 plus years, and I work in the field of medical advocacy. So this is just the where I'm coming from. You know, this is my lived experience, not to discredit theirs, but, you know, I actually haven't seen any new information come out about vaccines. Could you point me in the direction of that new information? And yes, it gets tricky when the CDC has changed their vaccine recommendations. But what I like to reiterate is, once again, where are the new data, right? It's asking, you know, and that's just one example. And I want to say, being clear, that this is me in my personal life. This was not like a Research America standpoint. This is me, you know, but trying to figure, and another general tip, and this is not an elevator pitch, but is addressing people from where they're coming, right? So just using the vaccine thing because this is something I care a lot about and I talk about in my personal life a good bit, is, okay, you know, we both want the same thing, right? So I, who am up to date, and I've had like, you know, 17,000 COVID boosters at this point, right? Like, I want the same thing for my child as someone who does not vaccinate their child once. We both want our child to live healthy and happy lives, right? And so, once again, I know that's not an elevator pitch, but what I try and do, whether it's about vaccines or anything, is find that common ground first and really get to the core of what are they wanting? What do they want? That person who doesn't believe in vaccines wants their kid to be happy and healthy, and that's something I understand. That's something I know. That's also a lived experience that I share, right? And so combating that is tough. And I will say, it's really tough. I was in a congressional office with a staffer, you know, and these staffers come from whatever background, or I almost said something not very appropriate, but, you know, these are often young staffers, and they, you know, I had someone tell me that amyloid beta wasn't real, like in relation to Alzheimer's. And so I'm like, do they not believe in the existence of proteins? Do they not believe in the cleavage of amyloid beta? Do they think it's like, what, you know, I'm not sure what they're not believe. I didn't know you could believe or not believe in amyloid beta, right? That was a new one for me. And so what it turns out that they were concerned about was scientific rigor and reproducibility, because of a prominent, as many of you have probably seen, a national intramural researcher at NIH at the National Institute of Aging, had for probably many years falsified Westerns and microscopy images, and that became the talking point to this member of Congress that, see, we're now 30 years behind in Alzheimer's research, and NIH is bad because amyloid beta was all faked. And that's a tough one, right? I mean, I don't know how to get someone to believe that proteins exist, right? But that's not the battle I fought. I really wanted to. I had an intern with me who I had to like muzzle a little bit. But what I said was, hey, I'm a scientist and I hate that. I hate bad science. I've seen some bad science. And that's one of the reasons that I got into doing what I do, is because I think that I really care about scientific rigor. I really care that our taxpayer dollars are going to science that is good science, because at the end of the day, I don't want my loved ones dying of Alzheimer's disease. I don't want to suffer from Alzheimer's disease. I want to support every caregiver who has a loved one with Alzheimer's disease, right? And so, once again, finding the common ground and saying, I hate that as much as you do, but let me redirect into what that issue actually was, right? I did not fight them over the existence of amyloid beta as much as I wanted to. What I said was that, hey, we actually hate the same thing. And I mean, I don't know if you all have heard, but hating the same thing is really a rallying cry these days. So, those are just some tips. Once again, I know that's not a direct answer to your question, but just wanted to share some experiences. And I know we're running way over. Okay.
All right. So I have to say, feel a little bit of hope, a little bit of optimism, a little bit empowered. So I hope you guys feel that as well. So thank you so very much for sharing. We are heading into break right now, but I just want to make sure you know, looking forward to lunch. When we're back in the exhibit hall, we do have our poster presenters in there today. We'll have lightning talks again today. We have therapy dogs today. And we're also having headshots today. So as you walk in the door, just to the right is some photographers. They're doing an amazing job. They even made me look kind of professional. So that was great. And I'm kind of advocating for getting the therapy dogs into the headshot pictures maybe with us. So I encourage you all to take advantage of those things. And please, please, please visit our vendors while you're there, because they really are helping our program come on. But if you will, please help me thank Savannah Sims again. Thank you. Thank you.